Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. Unfortunately, today's message is a somber one. The crisis of viral respiratory illnesses that we were predicting and expecting is now upon us. As you know, hospitals are simply overwhelmed, in many cases in ways that are even more significant than at any previous time during the nearly 3 years of the pandemic. In particular, children having difficulty breathing are taking up large sections of the adult emergency rooms across the province because there are no pediatric beds. Even Sick Kids Hospital has had to cut back on surgeries due to the crisis. While COVID-19 wastewater signals, outbreaks, and hospitalizations are stable, though still high, it is primarily influenza and RSV that have tipped us over the edge. Influenza is circulating much earlier than usual and at levels we normally don't see until much later in the season, if at all. With over 10% influenza positivity in Ontario, this trend is accelerating. RSV, or respiratory syncytial virus, is infecting large numbers of children all at once. Most children have only mild illness. However, for some, particularly young children and infants whose lung tubes are narrow, it can be life-threatening. All this is the last thing we need right now, but it is our reality. I know that many of you watching this, particularly those who don't work in healthcare or who thankfully don't have an ill friend or relative needing care, will have a hard time squaring the normal reality of your experience in everyday life with the unprecedented crisis that I'm describing. I understand this, and that's why these messages are so important, and I so appreciate you tuning into them regularly. But there are things we can do for ourselves and for our community. While there is no vaccine for RSV yet, and there is one in phase 3 trials right now, we do have excellent vaccines for influenza and COVID-19. If you have not had a bivalent COVID-19 vaccine or have not had your flu shot yet this year, now is the time. Many people under age 50 until now have not considered themselves at high risk for COVID, and so vaccine coverage in this age group has stalled. Please, if you are under age 50 and you do not have the bivalent vaccine, please book an appointment to get your bivalent and your flu right now. If you're the parent of a child age 5 or over, a bivalent booster and a flu shot are critically important right now. Our York Region public health clinics have bookings available, and you can book both vaccines at the same time. I did this myself last week. It was convenient, painless, and took only moments. Book an appointment at york.ca/COVID-19 vaccine or by calling Access York at 1-877-464-9675. As you have heard, and as I have certainly heard from many of you, there are loud calls now from the Ontario Medical Association, senior pediatricians, public health experts, family doctors, political figures, and many others for a return to mask mandates. Several polls released recently have indicated the majority of Ontario residents feel that now is the time for a return of mask mandates, certainly in crowded indoor settings. On the other hand, about 20% or 1 in 5 Ontarians would resist putting a mask back on. Of course, this is no simple matter. For the last few months, we've encouraged masks as a personal choice and for those who are most at risk. Unfortunately, right now, those who are most at risk are very small children for whom it's not easy to wear a mask and for whom there are reasonable concerns about social cues and education and significant controversy and challenges regarding enforcement in daycare and school environments. For this reason, for now, moving forward more strongly recommending and renormalizing mask wearing in crowded indoor environments or public spaces is reasonable, in particular where there are young children or any kind of vulnerable person, or in public spaces where people have no choice whether or not to be there, like transit. It is clear that recommendations and mandates make the most sense at the provincial level, and Dr. Moore recently made an announcement strongly recommending masks, but stopped short of mandating them. I look forward to sharing updates with you about this and other topics in the future.